Dr. Richard Gunderman is a Chancellor's Professor of Radiology, Pediatrics, Medical Education, Philosophy, Liberal Arts, Philanthropy, Medical Humanities, and Health Studies at Indiana University. He is a 10-time recipient of the Indiana University Trustees Teaching Award and received the Alpha Omega Alpha Robert J. Glazer Award for Teaching Excellence, which is the top teaching award from the Association of American Medical Colleges. In 2019, he received the Indiana University School of Medicine's Glenn Irwin Distinguished Faculty Award, and in 2020, he was awarded the Association of University Radiologists Gold Medal and Indiana University's Bicentennial Medal. He is the author of more than 800 articles and has published 15 books, including We Make a Life by What We Give, to Life with Those We Serve, Contagion, and Marie Curie. He currently serves as president of the medical staff of the Academic Health Center at IU Health, as well as the faculty advisor for FIRM. Welcome, Dr. Gunderman.
Thank you. It's a treat to be here. I don't know if you know, but FIRM was founded in 2016. I remember the event vividly. It was in Riley Outpatient Center, Conference Room C, that's in the basement of the Riley Outpatient Center, in February of 2016. And I'd like to just recite the names of the 4 students who I regard as the founders of FIRM. 2 of these students are now IU School of Medicine faculty members, and one of them is deceased. Their names are Zahab Hassan, Hannah Brooks, Christopher Sinzabaugh, and Hari Vasu. One of those people is now deceased, and I just want to say I have on my right wrist all the time, 24/7, 365, a green wristband which bears the name of the student who's deceased. And partly for that reason, FIRM, the efforts you all have made to put together and execute this program and to attend tonight are deeply meaningful to me. I feel like I carry FIRM and its mission with me all the time, in part because of my fond memories and dedication to the one of those students who's no longer with us. And I hope you appreciate the effort that went into putting FIRM together, and it's just an absolute delight to see it thriving from year to year. So thanks again to all of you who've helped make this possible. I want to talk tonight about what the cleaning lady taught me about medical excellence. But before I turn to the star of the presentation, the cleaning lady, I first want to note a major anniversary today, a very significant figure in the history of medicine, really one of the greatest writers who was ever a physician, died exactly 200 years ago today, February 23rd, 1821. And this is his life mask, which was created in 1816, the same year Indiana became a state. Now, he wasn't living in Indiana, he was living in England, but when we became a state, this life mask was made of this person. Does anybody recognize this individual? He's the greatest physician poet in the history of the English language. Nobody in our profession, medicine, has ever written poetry in the English language as beautiful or as important as his. And I'll just mention that, as I say, he was a physician. He's sometimes considered the greatest English poet next to Shakespeare. He lost his mother and 2 of his brothers to tuberculosis, and himself expired from tuberculosis at the age of 25. So he spent his whole life living with fear, uncertainty, anxiety, just as many of us have during COVID-19. But, and this, by the way, is if you've ever visited the Spanish Steps in Rome, which you should do if you ever make it to Italy, this gravestone is right next to the Spanish Steps in Rome. And this, of course, is the gravestone of the physician to whom I'm referring. who, in addition to writing great poems like Ode on a Grecian Urn and To Autumn and Bright Star, also coined this term negative capability. Who is this guy? Died 200 years ago today, exactly. Well, the answer, of course, is that it's John Keats. Maybe you've heard of Percy Bysshe Shelley or Lord Byron, and Keats was certainly in their number. But Keats described something he called negative capability. That's when a person is capable of being in uncertainties, mysteries, and doubts without any irritable reaching after fact and reason. That means instead of jumping to conclusions, we need to keep our minds open in hopes of learning more. And I'll say one more thing about Keats. This is a painting of Keats as a young man. Of course, he died at 25, but his thinking is very important for us. Perhaps some of you have read Thinking Fast and Slow by Nobel Economics laureate Daniel Kahneman, in which he says one of the main reasons we human beings make mistakes is because we think what we see is all there is to know. The famous Greek philosopher Socrates always said he didn't know. He famously complained or maintained that he didn't know, meaning, I think, in part, we need to be mindful of how much we don't know so that we can learn more. Socrates always said the person least likely to learn anything new is the person who thinks they already know everything. And finally, I'll point you to Alexander Solzhenitsyn. Today, we tend to think in dichotomies. I don't know, women versus men, blacks versus whites, conservatives versus liberals, Democrats, Republicans, science versus religion. That's a terrible shame because the world is far too rich to be reduced to any dichotomy, and that includes the good and the bad. Another Nobel laureate, this time in literature, Alexander Solzhenitsyn, said the world is not the kind of place you can divide up into good and bad people. The good people on one side and the bad people on other. In fact, the world is the line that divides good and evil doesn't divide us into good camps and bad camp. The line between good and evil cuts right through the middle of every human heart. And I think that's a very important thing to realize that we don't want to reach snap judgments. We don't want to jump to conclusions. We want to keep thinking. And one of the things we want to remain open to is opportunities to learn we might be inclined to dismiss. So this brings me to the star of tonight's talk, namely the cleaning lady. Now, you are all too aware of the price we've paid. Many of you are hundreds of thousands of dollars in debt, but we've all paid an immense price in terms of time to become physicians, and that's a price many of us will keep paying. I was teaching and earning a residence salary, but I basically got my first full-time job as a doctor at the age of 37, partly because I was in a joint degree program, partly because I'm not that bright and it takes me a long time to learn things. But it's a long haul, a career in medicine, just qualifying for a career in medicine. When you finish your training, you will be no less educated than the best educated person you know. The amount of time you will have spent in school and training will make you in the top 1% of education of the people in your neighborhood, the people in your community. And that's a great thing. You know, we know a lot as physicians: anatomy, physiology, pathology, medicine, surgery, pediatrics. But we should beware the supposition that we know everything. And I can tell you, I've spent a long time in school, in training. I've earned a decent number of professional credentials. I've been in practice for decades, but you can do all that and not necessarily become a much wiser human being. And some of the wisdom that's available to us as medical students, residents, and independently practicing physicians isn't doesn't lie with the faculty. It doesn't lie with textbooks or medical journals. Sometimes it lies with the very most unlikely of people, at least at first glance, unlikely people. And for me, one such source of wisdom was the cleaning lady. And remember that we can learn not only from professors of medicine, but from colleagues, from people junior to us, from nurses, medical social workers, chaplains. We can, in fact, learn a whole lot for our patients. The most admired physician in American history thought, William Osler thought patients were our greatest teachers. So the person I want to talk about, and this is not a photograph of the person I want to talk about works in the hospital and bears the title of housekeeper. She's actually been a hospital housekeeper for 30 years. And I don't know if you've had a chance to observe housekeepers, but they do things like making beds, changing linens, disinfecting rooms, restocking supplies, and as you can see here, mopping floors. She'd been doing that for 30 years, longer than most of our participants this evening have been alive. And her supervisors realized that she was significantly less productive than her coworkers. So they had a housekeeper who was cleaning fewer rooms per shift, mopping fewer square feet of floor than her coworkers. They decided to investigate, why is she so unproductive compared to everybody else? This again is not her, but it's a hospital housekeeper. Sometimes we need to see pictures of people who we need to recognize we should be learning from. So I'm showing us some photographs of hospital housekeepers. But when they followed the housekeeper, our hero for this story, they discovered that she was spending a lot less time moving her mop across the floor and a lot more time leaning on her mop. They followed her around and saw that she spent a lot of time leaning on her mop, talking to people. She talked to patients' family members, visitors to the hospital, who might be lost or in distress. She talked a lot to her coworkers. What did they conclude? She wasn't doing her job. Housekeepers are paid to mop floors. She was getting fewer floors to mop than anybody else. So they thought about terminating her. We'll let her go, replace her with a younger person who's going to be more productive. But fortunately, I don't know if you can see the housekeeper here on the right side of this image. It's a ghostly figure. But fortunately, her supervisors had their eyes and their ears and their hearts open. They didn't just look at a productivity chart, they watched our hero and saw what she was doing. And they observed, yes, she did spend a lot of time leaning on her mop talking to people, but when she talked to patients or family members or visitors, over the course of those conversations, people became less stressed. They became more reassured. They became visibly happier. In other words, a chance to talk with our hero, heroine perhaps, had the effect of lifting people up. By the metrics that apply to housekeeping, she was doing a bad job. Should have been disciplined, placed on probation, terminated. But they watched her in action and realized that as opposed to many members of the medical staff and nursing staff and hospital administration, encounters with her had the effect of lifting people up. They didn't just look at their metrics, they looked at a human being at work. And so, again, this is not our hero, but they had an idea. They said, you're not a very good housekeeper, at least in terms of productivity, but you are great with people. And they assigned her to the job of greeter. So when people came from the parking structure down the elevator to the atrium of the hospital, the first face they saw when they got off the elevator was hers. And they explained to her what they were doing. You've been doing this since you came here 30 years ago. We just didn't have a name for it. And she became the hospital's official greeter. What kind of education do you think she had? Where did she get her MD or her PhD, her master's degree, her bachelor's? Well, of course, she didn't have any of those degrees. She lacked all those credentials. In fact, she'd never even graduated from high school. She had a GED, a kind of high school equivalency certificate. You're going to be an MD. Compared to you, she didn't know much. But in fact, compared to us, she knew more than I do, and perhaps more than some of you do. She had a kind of wisdom you don't get from books. I don't claim to know where you get it from, but I think it's a kind of wisdom to which each of us have access. And if we set our minds to, we can cultivate it. So, for 30 years, her job was the physical cleanliness of the hospital, disinfecting, mopping, changing beds. Her job shifted to what I might call emotional hygiene. She might have been the single person in the whole hospital, which employed thousands of people, who, on average, did more to lift the spirits of the people being cared for in the hospital than anybody else. Before, her concern had been dirt, microbes, bacteria, the coronavirus or whatever. Her principal concern became something like cheer. She was the principal uh, conveyor of good cheer in the hospital. And in doing that, she was actually carrying out the motto of the hospital's founder, which is don't you are caring for people. You are caring not for diseases, but people. This is the exact opposite of our hero. This is Edvard Munch's painting, The Sick Room. Everybody in this painting is isolated, alone, downcast, anxious, afraid. Uh, this cleaning lady, who becomes the hospital's official greeter, becomes the principal source of uplift in the whole institution. She's one of the most poorly paid full time employees, but she does more than perhaps anything else for the psychology, the spirits of people in the hospital. Her shift officially is 6 a.m. to 2 p.m. She starts early and finishes early, but I can tell you she arrives every day at 4:30 a.m. Why do you suppose she does that? Well, I'll tell you. It's because that's when the first surgical patients start showing up at 4:30 a.m. She's not getting paid to work those extra 90 minutes every morning before her shift, but she shows up every day at 4:30 because that's when some of the most scared patients and families, people showing up for surgery, arrive at the hospital. To me, that suggests she's not doing it for the money. She's not doing it only for the money. She's doing it because she genuinely cares about those patients and families. So, who is our mystery person? Well, I won't tell you yet, but these are 5 of her blazers. The hospital supplies her with a blazer, and the patients and families and coworkers supply her blazers with pins. It's become a tradition to bring her pins, which she puts on her blazers. Some of them are pieces of jewelry, souvenirs people have gotten from their travels around the country, around the world. Sometimes they're team logos, I don't know, the Pacers, the Colts. Sometimes they're religious symbols, a cross, crucifix, something like that. Sometimes people even give her family heirlooms, really important sentimental pins that they want her to have. And she's actually been described by somebody who knows her well as a well decorated smile and hug. I don't know how well decorated you are or will be, but could you be a smile and a hug? You may have a great step one score or a lousy step one score. Your step two score may vary across a wide margin, but maybe you can be a smile and a hug. And that's good for the patients, but I just want to offer as personal testimony that's also good for you. In fact, it may be one of the most nourishing aspects of your work as a physician if you can be a smile and a hug to the patients, families, and coworkers who depend on you. So here's our mystery person. Her name is Miss Betty. At least that's what everybody calls her. And she spends her day in a place most people would rather avoid, right? A hospital full of sick people, full of frightened people. She deals with people in great distress all day, every day. But she meets every one of them with a smile. What percentage of your time in contact with patients do you spend smiling? She is a purveyor of good cheer. To what degree do you and I cheer our patients? And perhaps most importantly for Miss Betty, she's a source of hope. People actually feel more hopeful about their visit to the hospital, their care in it, because they've come into contact with her. She doesn't have an MD. She never did a residency. She's not board certified in any specialty, but she makes a tremendous contribution to the people in the hospital. And none of us is a Miss Betty, but maybe we're at least a shadow of Miss Betty. And maybe if we tried over time, we could help that faint reflection shine a little bit more brightly. Miss Betty doesn't get down. She says, the people I inspire me. To what degree are you inspired by patients, family members, colleagues? And one more remarkable thing about Miss Betty, the 30 years of her career as a housekeeper spanned years 45 through 75 of her life. She ceased being a housekeeper and became what we might call a greeter at the age of 75 years. Why would somebody keep working at an age long past the conventional retirement age? I'll tell you why. Because we human beings need to make a difference. We need to see the difference we make in the lives of others. And Miss Betty gets a chance to make that difference and see that difference every day at work. If Miss Betty can do that, perhaps we're capable of the same. So back to John Keats, remember negative capability. You might think I need to double down on my board review study materials. Go over those lecture notes one more time. I'm not sure anybody does that anymore, but at one time people used to study by reviewing lecture notes. I need to avoid missing any classes or something like that. But I think Keats was right. The guy who died exactly 200 years ago today, the greatest physician poet in the history of the English language, Keats was right with negative capability. Miss Betty's supervisors could have fired her because she wasn't a very good housekeeper. But they realized she possessed the most human wisdom of anybody working in the hospital. She was perhaps the most compassionate, uplifting person of any level of education, training, or salary level in the whole institution. And they found a niche for her where she shines and illuminates the lives of patients, families, and coworkers. If Miss Betty can do it, perhaps we can do it. Don't dismiss people because they're in housekeeping or food service or security. They're human beings 100% as much as we are. They've led lives 100% as much as we have. Sometimes the wisest people are found in unexpected places. And if we can remember John Keats' message of negative capability, perhaps we'll be less prone to overlook such people and ultimately become wiser, more compassionate physicians and human beings ourselves. All right, I'm going to stop there. Any comments or questions? I apologize, we're over time.